Good afternoon, everyone. We are here at the Shrine on Airline. It is such an exciting time for us. The day is finally here, and we've been anticipating this for quite some time when we could really do, in our parish, start doing mass vaccinations. Yesterday we had our own event at Ilario Center, and today we're really happy to partner with Ochsner on this, a major vaccination. Sorry about that. Major vaccination event. Ochsner has been one of our partners for quite some time, certainly this year as the testing has ramped up, and they've been a real incredible community partner with us, having testing sites every week at locations that we determine together with them. So we want to thank them for that. We also want to thank our own team. So we have Joe Valiente here from our emergency management department, Timmy Gotro, Addie Emsice. Yesterday they were back and forth between the two events setting it up. So our contribution to this is all the tents and the barricades and the cones and the office space and the restrooms. That's Jefferson Parish trying to help Ochsner get this event going. And of course, with their medical expertise. And I remember, and looking at some of these incredible people, we were out on a very cold Sunday many weeks ago anticipating this day. So it's really, really exciting for us. So with that, I want to let Ochsner come up here and tell you about their event today. Dr. Sandra Kemmerly, she's the System Director of Hospital Quality and Infectious Disease Specialist, and she has been critical. Dr. Kemmerly and I were saying we met probably a couple weeks after COVID started, sometime in March. It's been a long time coming, so it's good to be here with you at this event where we're getting vaccines to our public. So she's been a critical part of Ochsner's planning for COVID, even before COVID got to us in our state. So with that, I want to introduce Dr. Kemmerly.
Thank you, Parish President Shang, for having me here today. And that was a long time ago, back in March, talking about this pandemic that we were planning for. And today's the next step in the fight towards ending this pandemic and eventually bringing normalcy back that we all want so very much. We at Ochsner Health are so excited to be administering first dose COVID vaccines to over 1,200 persons today, those over the age of 65 and healthcare workers. Today is a dress rehearsal for mass vaccination events that we hope to host when more vaccine becomes available to our state. By partnering with Jefferson Parish and using a large space such as the Shrine on Airline, we're able to vaccinate up to 8,000 people per day in the comfort of their cars. And keep in mind, we need at least 80% of people vaccinated to reach herd immunity to get us out of this pandemic. We use this flu season to gain experience with drive-thru flu fairs in order to prepare for this day, and can't wait to do more of these for COVID vaccinations. We are so encouraged that so many of the citizens of Louisiana want to get vaccinated. This is great. As a physician who's received the vaccine, I urge everybody to get the vaccine when it's your turn. It is safe and extremely effective. We're grateful for our partnership with Jefferson Parish. We are happy to be a resource to the communities we serve. And thank you, Parish President Shang, for your strong leadership in helping us fight with COVID-19. I'd like to welcome now Dr. Chantel Aber-McGee, Medical Director, Region 1, to say a few words. Thank you.
Thank you, Parish President Lee Shang and Ochsner, for inviting me here today. This might help. So this week, our percent positives have decreased from 11.3 to 10.6. The incidence has also decreased of new cases, so that's a huge improvement. Nonetheless, our community transmission rate remains high, so we have to stay vigilant. When it comes to the number of tests that we've administered in Jefferson Parish, it's been over 500,000. 40,000 individuals have tested positive. And when we look at our statewide statistics, over 9,000 people have perished because of COVID, and a little over 800 have perished in Jefferson Parish. I think it's important that we remember those who have been disproportionately affected are minorities and older individuals. Therefore, we need to continue to be vigilant in who we actually vaccinate. So I'm asking all the providers of the vaccine to adhere to our Phase 1A and 1B Tier 1 guidelines. We have expanded that to those who are over the age of 65, to home health care workers, to interpreters for sign language as well as foreign language, to include our individuals who are also belong to the deaf and blind community. I would also like to say that we do have variant cases in the state, in the region, and in Jefferson Parish. So therefore, it is important that we continue to be vigilant in our efforts. We recognize that the UK variant, which is also known as B117, has a higher transmission, and according to the current research that we have thus far, it is suggested that it is more lethal. Therefore, I know we are approaching Mardi Gras, and a part of our tradition is that, it's a part of our culture, but so is survival. So we should try to survive. And while people are concerned about catching beads in doubloons, we should be concerned about not catching COVID-19. If you want to know where our vaccine and testing locations are, you can find it on the LDH website, on the Jefferson Parish website, and for those who do not have digital capabilities, you can call 211. Thank you.
Thank you. And if you all can see here, it's a very orderly event. They're running a lot of people through who are really excited. We're used to being at testing sites with Ochsner, and people in line worried, because they have symptoms, they feel sick, or they felt like they got exposed, or somebody new told them they were COVID positive. And this, if you get to see these people, it's such a different kind of site. It's people who are excited, who have been really looking forward to this day for a long time. It's so positive, and we know they're on their path to being more effective against critical disease and death against this terrible disease. So we want to thank Ochsner for being our partner with us. I know I was here this morning at 9 a.m. and there was just an excitement, and it was such a positive day. And I know for our healthcare workers who have had to really, tend to the sickest in our community and the dying, a day like this means so much to them, and you could just feel it in the air this morning. So it's such a great day for us. So with that, do you have any questions for anyone? Yes.
Curious, when do you think the general public will be able to get vaccinated in Jefferson Parish, and what are the challenges to getting to that point?
So I really don't know those kind of numbers. I mean, I know the governor's office and at the state level, they know the statistics on that. I know the governor has said that, and I've heard him at a press conference, that you kind of have to get 80% through a tier before another tier is sort of approved, and when they see the appointments slowing, that they know that's kind of the time. So with the opening of, last Friday, he opened up 65 and above. He opened up COVID and emergency personnel staff. That's how I was able to get my vaccine yesterday, and members of my emergency management team, as well as some March election staff. So that added more, the 65 and above added a lot to the line of people waiting. So, everybody is eagerly anticipating it. I want my kids to get vaccinated one day. It might be summer, fall, I'm not really sure. So I know everybody is eager to get all of their family members vaccinated. Yes.
I have a question for the regional
Yes.
director. How quickly would you say this has been a go from being a dress rehearsal to the big night where we can have mass vaccination? And then another question, little kids, we've been talking about getting the general public vaccinated by the summer, but what about kids under the age of 16?
Okay, so you have two questions. So your first question, it is a supply and demand issue. So we are still waiting on getting adequate supply. We know that our supply our demand is outpacing our supply. We are waiting on the single dose vaccine as well. So, we're hoping that the emergency use authorization will be approved, and that J&J will be released soon, so we can be able to have mass vaccinations hopefully starting in March. Having a single dose vaccine is easier to handle because you don't have to worry about a vaccine series and having to have a second dose. It would also be helpful for our young people, many of those who are in college and may have to travel, so they don't have to worry about returning to a particular location, as well as those who are transient. And so for different communities, having a single dose vaccine will help, and it will help not only in our supply, but also in our efforts to have a mass vaccination event. Now, in regards to the second question regarding younger children, we're still waiting on research and CDC guidelines in order to determine when it will be appropriate to actually, vaccinate children. And so once we have more robust information and research, and that's reviewed by the proper committees and task force, then we'll be able to address that particular cohort.
One more question for you. Teachers here in Jefferson Parish,
Well, we do think that teachers should be vaccinated along with everyone else in the community. And so obviously so vaccine allocation and administration is determined by community needs assessment. So we look at those who are truly most vulnerable. And so based upon the demographics that have had the highest share of the health burden, the highest hospitalizations, and unfortunately the highest mortality, it's been those who have been older, those who have been minorities, those who live in crowded living conditions, those who are essential workers. And so we're trying to judiciously and prudently, administer this. So we don't want anyone to be left out. We do value our teachers. We recognize that education is the foundation for all of us that are standing here. So it's just a matter of, properly allocating to those and administering to those who are most vulnerable.
Anybody have any other questions? No? Okay. All right. Yes.
Just one more. Would you be able to give us a sort of an idea of the historic nature of it? I mean, how big of a deal this is for Jefferson Parish and for residents here?
Well, I feel like when Pfizer and Moderna were approved in December, we were ready. Our team started preparing because this date has just been anticipated for so long. We've just been, I like to say we've worked really hard for 11 months, but it's been on the defense. And finally, you feel like you're on the offense. And it just changed the whole dynamic. It changed everybody's viewpoint. I mean, yesterday's event, we were all happy. We're almost like giddy in the morning. We're like giddy little kids on Christmas morning to be part of an event like that. And I felt like this morning is the same way. It's a completely different atmosphere. Everybody's coming up with a smile on their face. So different. So it is historic. It's personal in that these teams have worked so hard under such stress for such a long period of time. Certainly we've had other complications with storms, and certainly my team, having to deal with all that. That when you get here, you feel like it's well-deserved. It's work that you're happy to do, you feel honored to do. And I think that's what we're all feeling right now. And it's very critical because we've been waiting for this since December when it got approved. So just for Jefferson Parish last week, when we were able to get strike team approval for Grand Isle and for our Golden Age group, which was much smaller events, but that was a glimmer of hope. And then just in 2 days in a row, when we've had 2 drive-thru events in our parish, it means the world to me. So it's a very good day for us. Any other questions? Okay, great. Thank you all so much for being here.